Okay, so today we're going to dive into a really fascinating story about a dangerous childhood disease. It's about a group of doctors who, when faced with a life or death puzzle, realized the official rulebook just didn't apply, so they had to write their own. First up, what exactly are we talking about? It's called hemolytic uremic syndrome, or HUS for short, and it's a really serious condition that often hits children. You know it's HUS when you see this dangerous trio of symptoms. The body starts destroying its own red blood cells, platelet counts just plummet, and then the kidneys suddenly start to fail. And make no mistake, this is a huge deal. HUS is actually a leading cause of acute kidney injury in kids, which means it's a true race against time. To prevent permanent damage, you have to get a diagnosis fast, and you need a treatment plan that's immediate and effective. The stakes are just incredibly high. As the Indian Society of Pediatric Nephrology puts it, for a lot of these kids, we're not just talking about a risk of getting sick, we're talking about a very real risk of needing dialysis just to stay alive. All right, but this is where the story takes a really critical turn. See, doctors in India began noticing that the HUS they were seeing in their young patients, it just looked very, very different from what doctors were reporting in the rest of the world. So, typically, around the world, HUS is linked to a nasty bout of food poisoning from a specific type of E. coli. But in India, totally different story. The doctors there realized the cause wasn't some outside infection, it was the child's own immune system launching an all-out attack on their own body. And we're not talking about a small number here. This specific antibody-driven type of HUS accounts for around half of all pediatric cases of what's called atypical HUS in India. Atypical just means it's not caused by that common E. coli bug. This paints a massively different picture than what doctors were seeing in, say, Europe. And this chart just spells it out so clearly. The scale of the problem was enormous. This version of HUS was 5 times more common in India than what their Western counterparts were used to seeing. They weren't just dealing with HUS, they were dealing with a fundamentally different disease. So you can see the problem, right? This unique cause created a huge dilemma. The standard international treatment, the one all the textbooks recommend, was designed for a different problem, and to make things worse, it was completely out of reach anyway. See, international guidelines all point to one drug, eculizumab. It's this powerful medication that basically tells the immune system to stand down, stopping this kind of autoimmune attack in its tracks. It's considered the absolute gold standard of care. But here's the massive roadblock. Eculizumab is one of the most expensive drugs on the planet. It just wasn't an option for patients in India and in so many other developing nations. The gold standard was completely off the table. So with their best weapon unavailable, they had to turn to something else, a different, more challenging treatment that was described as, well, less than ideal, but the only alternative. That alternative was plasma exchange, or PEX. So what is PEX? Honestly, the best way to think about it is like a deep cleaning oil change for your blood. It's a procedure where a machine filters the patient's blood, physically pulling out those destructive antibodies that are wrecking the kidneys, and then replaces that cleaned plasma with fresh, healthy plasma from a donor. So they're facing this massive dilemma, right? The wrong disease for the standard treatment, and no access to that treatment anyway. Well, this is where the Indian Society of Pediatric Nephrology did something truly remarkable. They developed their very own set of guidelines, tailored to their reality. And their approach was just so smart and practical. Step 1, make sure it's actually HUS. Step 2, rule out other local diseases like malaria or dengue that can look kind of similar. And step 3, the absolute game changer. Test for those specific anti-factor H antibodies before you do anything else. They even established this key diagnostic number, a level above 150. If a patient's antibody level was over that threshold, bam, that confirms you're dealing with this specific antibody-driven HUS, and that result kicks off a very specific treatment plan. And this part is so crucial. That test wasn't just a suggestion, it was a hard and fast rule. And why? Because the treatment involves seriously suppressing the immune system, and you only do that if you are 100% certain the immune system is the thing causing the problem. No guesswork. So their plan became this powerful, 2-pronged attack. First, you hit it with intensive plasma exchange to handle the immediate threat. Get those bad antibodies out of the blood right now. And second, you use immunosuppressant drugs to basically shut down the factory, stopping the body from making any more of them. And you know what? It absolutely worked. By tailoring the diagnosis and the treatment directly to the specific enemy they were facing, they dramatically improved the outcomes for these kids. They were saving lives with a plan that was born out of pure necessity. So what's the big lesson here? This is such a powerful story about medical innovation. It's not just about a disease. It's about what happens when you're forced to think outside the box. You know, this whole story is basically a masterclass in how to practice medicine in the real world. It teaches us to adapt global knowledge to what's actually happening on the ground, to innovate when that so-called gold standard is just a fantasy. It's about creating solutions that are practical, affordable, and that actually work. And then sharing what you've learned to help everyone else. And this wasn't some kind of compromise or a second-best option. As the guidelines state, it was a systematic and algorithmic approach that was specifically built for their unique patients and the resources they actually had. It was a targeted, intelligent, and life-saving strategy. And that really leaves us with a vital question, doesn't it? This model of resourceful, tailored medicine made a massive difference here. So it makes you wonder, where else in the world and for what other diseases could this exact same approach save the most lives?